Dubai is supporting and embracing the digital revolution and innovation in healthcare.
Good morning and welcome to Actionable, a podcast brought to you by Seed Group. My name is Michael Makdah and I'll be your host today. With me today is a very special guest, Vinay Lazarus, a senior healthcare executive and a senior general manager at NMC Health, also one of Seed Group's healthcare advisors. And today we will be discussing the healthcare industry in the UAE and specifically. So welcome to Actionable.
Good morning, Michael. Thank you for getting me here.
Great. I'm going to start off with a quote for His Royal Highness Sheikh Mohammed bin Rashid Al Maktoum, the Vice President of the UAE and the ruler of Dubai. He said something a while back that resonated very well with me. He wants Dubai to be number one, not in the region, but in the world. Number one in everything from education, health, and housing. And I want to give my people the highest way of living. And that's just a beautiful quote. And I think pretty much the roadmap for a lot of things in the UAE. Vinay, to ask you directly, if you want to advise an entrepreneur or a founder in the healthcare space to expand into the UAE, what actionable insights would you give them?
Thank you, Michael, for the introduction. Yes, the vision of Dubai is very much clear, and to reach that goal of our visionary and our leader, and His Highness Sheikh Mohammed bin Rashid Al Maktoum, reaching this goal is a very natural ambition for Dubai, the flourishing city, which has become home to people from all over the world, who were inspired by its vision and want to join its movement towards progression. We believe that we are all responsible for the health and safety of our people and confident in the capabilities of those concerned in the healthcare service delivery, be it a public or a private healthcare organization. We are quite keen in working on the initiatives that have been set up by the city of Dubai, that is to boost Dubai's position as a global hub for medical education, disease prevention and promotion of health, provide attractive infrastructure and investments, encourage innovation in healthcare sector, achieve highest international standards in medical services, improve preventive healthcare measures, boost Dubai's position as a global hub for medical tourism, enhance the quality of medical insurance. So, going forward, how and why should anybody be coming to Dubai? And why should they be here? Well, there are a lot of reasons. There is a growing population that entails a greater need for health services. There are landmark projects and infrastructure that support the development and the growth of healthcare sector. There is a high prevalence of chronic and non-communicable diseases, indicates that there is an increased need of health services, associated tertiary care expertise and chronic disease management. Health coverage for all of Dubai's population sustains the development of healthcare sector for both residents and tourists. Private sector utilization has grown significantly and will continue to rise. Dubai is supporting and embracing the digital revolution and innovation in healthcare. A leading position as a health tourism hub with scalable growth opportunities gives enough reasons for anybody to come to Dubai for investments.
So let's zoom out a bit. So now that we've covered Dubai, tell me a little bit more about the healthcare landscape in the UAE specifically.
Well, healthcare landscape has been evolving for a long time, and post-COVID, things have emerged, and there is a lot of focus which have moved on from personalized healthcare into digital health. That's what is going to be the future of healthcare. And we see that digital adoption to improve the patient outcomes will be the focus. And value-based healthcare would be the key element that will be the driver of healthcare landscape in the future.
Right. And in terms of the challenges that are faced in the healthcare system, so what recent challenges are we facing? In a post-pandemic world.
Yeah, as we start off, we emerge on to the digital space, and there are certain challenges that the healthcare providers would be facing, and as a society, it will be the number of challenges would be potential areas of health reform including healthcare sector fragmentation, rising costs and uncertain outcomes, proper regulation of the fast expanding private sector, shortage of national health, human resources, coupled with the difficulty in retaining and supporting career advancement of expatriate human resources, population growth, and increased levels of chronic disease risk factors are some of the challenges. But yes, as we partner with the government, we are all set up to face these challenges. Yeah.
And sort of, how does the public healthcare system work in the UAE? Since you've been here for how many years now?
I've been here for past 8 years.
8 years.
It has been an exciting time, and public and private healthcare work closely with each other. Whereas public healthcare, we have got large tertiary care hospitals which focus a lot on the nationals and the citizens of the UAE. But yes, they are accessible by the expat community also if required. But the private healthcare space is quite exciting, and it has been evolving over the years. We have the best of the surgeons and the best of the clinicians of the world here, and we have some big players in the market who are driving the private healthcare service delivery here. And in the public space, we have the best of the names here. We have the Cleveland Clinic in Abu Dhabi, we have the Mayo Clinic, we have the King's College Hospital from London here, we have the American Hospital here, we have Mediclinic, one of the big players in the healthcare segment is here. Then we have NMC Healthcare, which is leading the private healthcare space.
And so tell me a little bit more about how insurance is impacting the healthcare space.
Well, insurance is a big support to the healthcare delivery here because the mandatory insurance and the penetration is very high. It's close to 95% in the market. Everybody has an access to healthcare. And going forward, the primary care will be the focus of the insurance providers. And this is a good initiative because we have a lot of people coming into the country over the year, throughout the year, and it will give them a good coverage and healthcare will be accessible for them. And as an insurance providers not only provide you a coverage, but they do keep a tab on the healthcare spend of the country, and also they monitor the disease burden of the country. There are a lot of data which is shared by the insurance company with the healthcare providers as to how we can improve our healthcare outcomes, how can we improve the patient experience, how we can improve the complete patient journey. So the health insurance is definitely a payer, but it provides a great support in healthcare delivery also.
Right. So you mentioned to me earlier this morning that the government is very keen on preventive measures. Could you tell me a little bit more about how they're maneuvering these preventative measures with healthcare?
Yeah, preventive healthcare is the focus of UAE because post-COVID-19, we realized as healthcare providers that there has been a disease burden, a chronic disease burden, which would increase if we are not able to monitor it at the right time. And preventive care screenings, whether it's cancer screening, whether it's cardiovascular screening, I think that's the best way forward to combat with any kind of chronic diseases. Going forward, the government is laying a big emphasis on preventive care where we screen each and every individual coming into a hospital for diabetes, for hypertension, for any kind of a cardiovascular ailment or any kind of a chronic disease that we can tap at the right time. And that's the best way forward, instead of getting somebody landing up in an ER with a stroke or with a cardiac ailment, and if he has not been evaluated in past 1 year for his diabetes or a cardiovascular ailment, I think it's the responsibility of a healthcare provider to do that. And that's, I think, a great example what has been said by what's happening in the US, Canada, and the UK. This is something that we should be able to start off and get the benefit passed on to the patients at large.
And in terms of comparing the UAE to other countries, I mean, you have international experience in different markets. How is our healthcare system different than the other healthcare systems around the world?
Great question, Michael. I've seen the healthcare market in India. I've seen the healthcare in Canada and the UK and in Europe. But I feel so proud to tell you that Dubai has got the best healthcare. And it's just not got the best healthcare, it has got the best accessible healthcare to the community at large. As we were talking in the morning, that's to access a neurosurgeon, I will have to wait for 6 months in Canada or probably anywhere in Europe. If I have to consult an endocrinologist, I'll have to still wait for my results to come and for my GP to assess my results for another 3-4 months. But here I can get out of my office and consult a neurosurgeon, a cardiologist, or an endocrinologist tomorrow itself with a prior appointment, and I'll be investigated and I'll be provided the right treatment straight away. There is no waiting. So accessible healthcare is something which is a key, which people are not talking in the Western countries, and they find it as a big challenge. But here in Dubai, we are able to do that to anybody and everybody. So that's the best thing. And we have got the best clinicians, we have got the best surgeons and the best facilities what the world can offer with the best quality standards in place. So it's an exciting time for us.
And in terms of the role private healthcare has been playing, has it had an impact on elevating the UAE's healthcare plan?
Oh yes, private healthcare space has been evolving, and we have seen the growth of. If you really see 10 years back, we would have just 5 hospitals here in Dubai. We have around 25 hospitals here, and each one of them offer a different kind of an expertise. You have the premium healthcare, you have a secondary healthcare being provided to you, you have primary healthcare being provided to you through clinics, and it's just an amazing journey, a healthcare journey in the past 10 years that we have seen how healthcare has evolved, and we have contributed, and we have seen there were a lot of people 10 years back used to move out of Dubai for medical treatment. Now we don't see anybody traveling out of UAE for any kind of a treatment. We have the best oncology treatment here, we have the best neurosurgical skills here, we have one of the best cardiovascular treatments available in the country. So there is nothing that the UAE is lacking in terms of healthcare delivery.
And I think now we're seeing sort of the coin flip on that specifically. So we're seeing people traveling into the UAE for healthcare. If you could tell us a little bit more about the confluence of data in the healthcare industry, and how has that sort of impacted, the outcome of patient diagnosis, for example?
Going forward, as we discussed earlier, telemedicine, personalized medicine, genomics, wearables with organizers leveraging artificial intelligence, cloud computing, extended reality, and Internet of Things will be the key elements that will develop and deliver new treatments and services. And that is what is going to happen in Dubai and the whole of UAE. We see that the patient is well informed, they have got a lot of data and are more plugged in finding different options of care that best benefits them and also benefits their wherever they can save money. And the transition to value-based care will produce immediate and wide-scale results. And we see that the data, electronic medical records are being consolidated within the country, and the data will be accessible by the patients and the providers and the government at large. So the healthcare providers can easily access the disease burden, and they can plan out the treatment modalities for a patient much before the patient lands up in any kind of an emergency situation. So data will play a big role. The medical records will help us evaluate a patient much before he comes to the hospital with emergent medical condition. So data is the future, and we will have to enable digital solutions into the healthcare space, and we look forward for partners who want to set up their platforms here and engage with the healthcare providers in Dubai, and it's an exciting time for all of us.
So we have this, big wealth of data coming in, with from wearable devices, from clinical visits to different areas. How's that data sort of feeding back into the private healthcare system, especially such as insurance?
Yes, insurance is able to, again a good thought. that how can data help the insurance providers and how it can help the healthcare providers at large. Yes, it provides them the disease burden, that what exactly the community is going through and what should be the focus areas. And probably if they see a high element of chronic disease, which is going to evolve after 5 years or 6 years, that patients will have a lot of like a higher element of diabetes or higher element of cardiovascular diseases in the population, they can set up some screening programs with the healthcare providers. They can stress upon, they can improve the reimbursements for healthcare providers who engage with healthcare preventive screenings like cancer screening, cardiovascular screening, diabetes screening. So these are the key focus areas that insurance providers are already derived a lot of information from the data that they have collated over the past 10 years. And the focus is now the preventive care.
All right. And in terms of megatrends in the healthcare space, so, wearables are one, machine learning could be something, artificial intelligence. How is the new anatomy of a healthcare system?
The new healthcare will be more of a hybrid healthcare. That's what we are looking at. Hybrid healthcare, as we have seen in the COVID-19 era, we were restricted to visit a hospital or clinics, or the hospitals were restricted to even do any kind of elective surgeries, and patients were isolated at home, but they needed that care to be provided at home. And we as healthcare providers, we enabled the telemedicine, we enabled the teleconsultations, we enabled virtual consulting with our doctors and patients at the comfort of their homes. So we realized that the patient need not come to a hospital setting or a clinic setting where he might get exposed to an infectious environment, or might be immunocompromised who doesn't have great immunity. He can be provided healthcare through the virtual space. Through his wearable device, we could monitor his blood pressure, we could monitor his sugar levels, we could monitor how well he has worked out during the week, whether he has exercised much or not. And we can even do prescriptions, and the patient need not come out and he need not undergo a stressful experience of going to a hospital, waiting for a doctor, waiting for his prescription, waiting for some medical tests. We could deliver that in the comfort of his home through the virtual space going forward. And that's what the hybrid healthcare, which is evolving, and preventive care. And we can monitor the healthcare, we can monitor the patient's health without visiting a hospital. So that is going to be the future, and you will have to visit the hospital only in terms of an emergency or some elective procedure that you land up with.
And sort of the role in customization, is that impacting healthcare in any way? So I heard, for example, people are customizing medicine for the individual so that they can react to it in a better way, for example.
Yes, digital pharmacy and pharmaceutical products is something that pharma companies are again focusing a lot on from the data that they have evaluated and through the patient screenings, and what is the data that they have pulled out, and they are evolving the medication specifically to a particular age group, particular ailment, or even particular demographics. So that is something which has to be tested. It is being tested out. We are yet to see the results and how good are the outcomes. And once it is certified and approved, I think UAE should be able to practice that soon.
3D printing and healthcare system, does it have a place?
Yes and no. Yes, because healthcare, we cannot do any hit and trials. We have to follow the certification. We have to follow a lot of approvals, and we are glad that we have some great regulators here who monitor each and every pharma product that comes into the country. And we would be quite keen, but no, because if we have not seen some great results, and we cannot expose our patients to something which is being still tried out in the market. Once the results are published and there are enough papers to support that, we'll be keen to take up these new products.
Great. All right. So thank you, Vinay, for joining us today on Actionable. We hope to see you hopefully sometime in the near future. In the meantime, if anyone wants to connect to you, what's the best way to reach you?
Thank you, Michael, for an exciting discussion. It was great being here, and people can connect me through the LinkedIn, through my profile there.